Mandy here. So in this video I'm going to talk about how the surgery went and my first week of recovery. If you watched the previous video, you'll know that I went to Phoenix, Arizona at the Mayo Clinic there to get my surgery done. I live in Orlando, Florida, and my surgeon was Dr. Jaroszewski. So day before surgery, you go into pre-op where they take your blood and take, kind of vitals, things like that, get your weight. And you get to meet your surgeon, talk with them, meet the RN. So I met everybody, and I was really confident in them. It was really great to meet everybody, Dr. Jaroszewski, Mary Ann, the RN, and Kelly, the coordinator, so that was awesome. Got some x-rays taken, some pictures taken. And so the next day was the day of the surgery, September 24th, 2015. And I went into the hospital at 5:30 in the morning. I really wasn't nervous. I was kind of excited. I didn't know what to expect. I've never had surgery before, never broken a bone. I just totally new, element for me. But went in, and they took me to a limbo room, I call it, where there's just like rows of beds in the curtain rooms, and everybody's either preparing for surgery or getting out from surgery. And I got a gown, compression socks, I got IVs put in, given some medications, and my family that was with me was able to come see me. It was my mom, my aunt, and my grandparents. They all came from different states, so that was really awesome to have them there. And they were the last thing that I remember. They gave me this medicine that completely knocked me out. I don't remember saying bye to my family. I don't even know if I did. I don't remember being rolled away or anything. Next thing I remember, I came to in my hospital room. My mom was there. The first day is a complete blur. Sometimes I think that maybe I mix things between the first and second day together. I don't really know which things happened on which days. It was just a total blur, really. And so first day, don't remember much of anything. I know I slept a lot. I don't remember being in a whole lot of pain. I remember being surprised that I wasn't in as much pain as I thought I was going to be in. So that's good. And second day was more lucid. I know I was watching Bob's Burgers on the TV. I remember talking to my family and my mom. The pain that day, I believe I told them, was a 6 out of 10. And I had my morphine pump, so I used that whenever. And the nurses came in and gave me my medicine, and all the nurses at the Mayo Clinic there were fantastic. I loved them. And the food also was really good, surprisingly. I was worried about that because I feel like stereotypical hospital food just sounds gross to me, but it was really good, so that was cool. That's pretty much it for the second day. I just laid there and slept a lot. When you sleep, you're propped up. You can't really sleep laying down. It just is not comfortable. Second day I realized I had a catheter in, and I had a drainage tube, this big box, about this big, sitting up on the floor next to my bed, was draining out this blood and fluid mixture. It was lovely. And third day was a lot more lucid. Got up, got my catheter taken out, got my drainage tube taken out, went for a walk, short walks, 2 of them. Got tired pretty easy. Also, third day was also the most painful day, and I think that's because they took away my morphine pump. I believe I told them a 7 out of 8. But I got my medicine, oral medications, and it wasn't so bad. But I got discharged on the third day, went back to the hotel, and I stayed there for about a week while my family was there too. So that was nice. I did a lot of sleeping. Was still propped up. I had all the pillows behind me when I slept, and I used this, and I think this came in so handy. I would recommend getting this. It's one of those, neck pillows for airplanes. Because when you're propped up sleeping, the pillows don't go all the way up to your head, so you're just kind of lagging. So this was helpful. Also, when you leave the hospital, they give you a whole lot of medicine. So here's my box of medicine that I still have with me. It's 2 different kinds of laxatives because the painkillers stop you up. Oxycontin, oxycodone, ibuprofen, gabapentin, A lot of things for pain, some things for nausea, which I was never nauseous, so that was nice. And I'm really not somebody that likes to take a lot of medicine. I'm more of an herb person. So I was not really looking forward to all that, but the first week I took everything religiously. My mom and I made a schedule for the medicine. That way we just really kept on track with it. All throughout the day and all throughout the night, I was woken up taking the medicine, and it was really worth it. 5th day, I was still in the hotel, was the worst pain that I had been through with the surgery, and I think in my life. My local anesthetic that I was given, it was called my on-cue ball. You get 2 little tubes that go into your sides. It ran out. It was supposed to run out. And you don't have a refill. So now, instead of your, everything that just got worked on being numbed a lot, I could feel a lot more, and I woke up and was in so much pain. I'd say a 10 out of 10. But I just took my medicine, and I think about an hour later it was okay. But it was definitely the worst pain ever. But you get through it. And when you also leave, you get one of these little spirometer things. When I was in the hospital, the nurses wanted me to get up to a 2,000. And when I left Arizona, so a week after, I was still here at like 500. So I talked to my RN, and she said that that was normal. Some people are different. And it's, it gets better over time. But so don't worry if you're not exactly where they say to be. You just need to keep practicing. I practice that every day. I got these acne pads. I'm not really prone to acne, but when you're in pain and you're sweating and you're taking all this medicine, you just feel like crap and kind of gross. So I use these. I had some baby wipes that I used to, also help make myself feel a little better. I also showered when I got back to the hotel. Showering was really hard because you don't realize you can't have your arms up past here. It's like you just can't even get them up there. So showering my hair was really hard. It was pretty much impossible, actually. I'm positive I left crap up in my hair. And reaching down to crevices and things was really hard too. So bathing or showering was difficult, but I did do it a couple times. I always made sure my mom was in the bathroom with me because I just didn't feel completely steady. And I also recommend to wear button-up shirts. If I would have known this, I would have brought nothing but button-up shirts with me, because changing out of a shirt, if you can't lift your arms up, is really complicated. Where I had one shirt that was a button-up, and you just put your arms in like this, and it was super easy. So I would recommend doing that, or bringing those if you have to go somewhere. And that's pretty much it. First week was the most painful, but I also slept a lot and was on a lot of medication. So first week is pretty blurry. And a good thing about your body is your body doesn't let you remember the pain. So, you just get through it. It's fine. They also gave me this brace when I left the hospital. It's just a generic body brace. Goes around you like this. I never really used this one because it was really uncomfortable. I ended up buying this brace from, I believe their company is called All About Pectus. It is All About Pectus. They custom make their braces just for the corrected rib flare. So this one just goes around like this, and you get to adjust it as time goes on. They say to wear it for about 6 months afterwards. For the first week, I did not wear this because it hurts so bad. But over time, I was able to wear it. But I did get this. And also, since I was out of state, I flew back to Florida, and I was really nervous about the flight back because I didn't know what to expect. I didn't know if the pressure change was going to, make breathing weird or pain worse or anything like that. Totally fine. I slept on the plane. It was about 3 or 4 hours, can't remember. But, you know, there was no difference in pain. It was totally fine. Pressure change didn't affect anything for me, so if you're worried about flying, don't be. It definitely beats driving, because when you drive, you feel every single bump in the road, and that is painful. So flying was definitely a good option for me versus, you know, 5 days of driving, or however long from Arizona to Florida. And getting into the airport was fine. I was in a wheelchair, and they just kind of patted me down from there. And I told them, I was like, I just had surgery. Please be careful. And they were. Everyone was really considerate. So that was fine. So that's pretty much it for the first week. A big blur, lots of sleeping, some pain, but you get through it. So my next video, I will talk about my second week of recovery. So I'll see you then.